Back in 2018, I got talked into an unnecessary back fusion surgery, and the surgeon, who was Dr. Jonathan Hott in Phoenix, Arizona, it's Hott, ended up smashing my spine where it collapsed in a few weeks, and I had to have another surgeon try to surgically reconstruct with bone graft my spine. I now have 2 plates and 9 screws in my L4, L5, and unfortunately I live in chronic pain and have ever since. Obviously my position has not improved, it's gotten worse, and that'll just keep getting worse over time. There's no surgical option for me, it's just a matter of managing my pain. But as someone who works in the healthcare field, I work with a lot of people and I get a lot of patients who are in pain. And my coworkers really don't have an appreciation for people who are in pain, and certainly people who live in chronic pain. And I thought of this, maybe this will help if you care to know. So I came up with this idea. If you take a sensitive part of your arm, this probably only works on a girl, but if you're a guy and you care, you can try it. So you just take a little bit of the skin and lift it off, kind of where it's like, oh, and then squeeze it, and that hurts. Now pinch it really hard and then twist it. Not too much, but enough where even just pinching it constant, that should bother you. So you hold it there, and then if you twist it a little bit to make it worse, that's uncomfortable. Okay, so people in chronic pain live like that, hour after hour, day after day, week after week, months, years. Sometimes pain medicine can dial it down a little bit, but I'm never out of pain. I'm always in pain. It's just a matter of what level am I at pain. Now, people who live in this chronic pain, if you hold it enough so it hurts, it's distracting. You think it distracts the way, you work and you think and you interact with people, because, you just keep thinking, God, just make it stop. Just let go, stop. And it won't stop. You can't let go. The pain won't end. And then if you exacerbate your situation, or, something happens, age, time, maybe you did do something to make it worse, turn it even more where it's really painful. That is acute pain. And you're just like, oh my God, someone's got to make it stop now, and that's a trip to the ER. You've got to get IV medications. You've got to get a block. You've got to try to do everything you can. So I don't know if that helps people, but I think too many people don't appreciate what it's like to live in pain. And it's unfortunate because it's a miserable way to exist. The only thing I would ever wish for my life is to not be in pain ever again. Obviously, my life is very limited. I used to run, go to the gym, swim, hike, bike. I would do all these things. I was very active and I took care of myself. And now I can barely get across the floor to get something to drink or go to the bathroom or bathe and, get my activities of daily living completed. It's really miserable. I know a lot of people look at me and they say, oh, you don't look like you're in pain, because I'm suffering and I'm used to it and I'm on pain medication. At least it dials it down where I can function. But it ruined my life, and I really feel for people who are living in pain. And my only prayers for myself and everyone is that no one goes through living in chronic pain. It's so awful. And sometimes it can just get distressing in that you think there's no end to this. This is it. How old am I? How long am I going to live? And it's just going to get worse, Who knows? Maybe they'll come up with some treatment and I'll be able to get out of pain. They can't ever fix my spine, But I guess you never know. I'm not going to hold my breath though. I'll be going into more detail and doing longer videos about that whole process and everything that Dr. Jonathan Hott did to me after ruining my back, which was atrocious, hateful, evil, and frankly, only a monster would try to do after he already butchered me. So stay tuned if you want to see that, and I hope that helps. God bless.